Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you for joining us on the program today. Our guest in studio is Dr. Charles Mahl, certified in age management medicine by the Synergenics Education and Research Foundation, and he's completed fellowships by the American Academy of Anti-Aging Medicine, the Age Management Medical Group, and the Living Younger System of Preventative Aging. And he's here with us today to discuss age management medicine. Welcome back to the program, Charlie.
Hi, thanks, Neal. Happy to be here.
Thanks a lot for returning and giving us some more of your time. You're here to talk today about age management. You're certified in age management medicine. You've gone from retinal surgeon, you're specializing in regenerative medicine there in Florida. Talk about your practice as it pertains to age management.
Well, I think age management is sort of another area of regenerative medicine, and again, I'm living in Florida now where the weather is mostly great except when it's for the occasional hurricane. And people want to be young here, want to feel good, want to be healthy, and really what age management means is it's a way to delay the aging process and to try and live a healthy lifespan. I mean, we all are going to age, we're all going to die one day, but how soon and to what extent that happens is determined by several known factors, and if we can address these factors and minimize any risk that we could have, we could live a nice, long, productive life and be healthy along the way.
You mentioned delaying the aging process. Is that completely accurate? Are we talking about actually delaying the process or simply making the process of aging, giving us a better quality of life by learning how to live better?
I think it's both. You get a better quality of life, learning how to live better, as you said, which was well said, and at the same time, you can delay the aging process. A man 70 years old now can be what can live like a 50-year-old now. A man 50 can be like a 30-year-old. So we have methods available to us now to keep people young and vital, both men and women. And you actually just led me into what we call bioidentical hormones. And we're talking about men. We have the capabilities now, and going back to women, let's talk about menopause. Everybody knows about that. Women, after the childbearing ages, things drop off, and the hormones really drop to a low level, and then women tend to age faster. We have hormones now that we're able to give women that are bioidentical to what's normally in their body and keep them looking young, feminine, and vital after menopause. And at the same way, we've identified for men at a certain age, they go through what we call andropause, which is the level of testosterone drops down, their muscle tone becomes less, they start having sleep problems, their bone density and strength weakens and whatnot. So we're able to replace testosterone in men and give them youthfulness and vitality and live a long, productive life in that regard too. Men regain they reduce their fat, they increase their muscle by testosterone intake, improve their concentration, and maintain their sleep, their bone density and strength, all sorts of things. Testosterone helps, and it's been proven that it does not cause heart attacks or cancer or things like that. We know men do better having a normal level of testosterone than a low level of testosterone. Men with low level of testosterone actually age very fast and are prone to problems. So there's a lot of literature out there that really lets you know that this is good for men who have these type of problems. And it's not necessarily just men in their 50s or 60s or 70s, even the 80s. I have men who come to the office in their 30s who have what we call low testosterone or low T, and there are ways of building that up for them so they can be self-confident and productive and youthful and vital and have less intimacy issues and etc. So it's a really wonderful field now.
Are there any treatments that involve delaying some of the diseases that come with aging, regardless of whether you're a 70-year-old guy who's got the stamina and vitality of a 50-year-old guy? Are there things that address the cognitive issues that maybe come with this? with age?
Absolutely. In the office, actually, we do something called biomarkers of aging. So it's just what you alluded to, which is we can do testing on the brain or on your lungs or on your heart, and that'll tell us if you're functioning at the level of a 50-year-old or a 70-year-old, depending on what age you're at. So let's say you're 50 years old, testing comes out, you're functioning at the level of a 32-year-old man. Everybody's happy. If you're functioning at a 70-year-old level, we're not that happy, and we want to address those issues. We can find out if you're heading into Alzheimer's disease or any type of memory loss or Parkinson's or whatnot. And the other thing about this is there are simple things that most people really don't do. Good living, I call it. Eating well, alcohol in moderation, not smoking. It's basic things, but a lot of the population just doesn't follow this type of lifestyle. So some of the things people do, they get in trouble with a bit of excess alcohol or excess, somebody loves dairy products and it raises their cholesterols and triglycerides. So we have we know the factors, that's what we talked about earlier, the factors of keeping your cholesterol and triglyceride counts in a normal range, and alcohol in moderation. That old saying, everything in moderation is okay for you. We now know that we're able to look at our hormones, our sex hormones, and keep that in a optimal level to keep us young, youthful, and vibrant. So healthy eating, and we'll get into that when we talk about weight loss, and you'll laugh because some of the things are so simple, but we don't really follow them, including myself. And I have a saying about medicines and whatnot. Unless you need a medicine every day that's critical for you, if you can take your vitamins and supplements and whatnot, 80% of the time you're going to do fine. So you don't have to be 100% at it or beat yourself up if you can't do it all the time.
When, in your opinion and experience, when would you say, or does there exist a point at which it's too late to begin some positive age management strategies? Now, you operate a practice there in Florida. It's Gen Life. Are age management therapies part of the services offered at Gen Life?
Yes.
Do you think that there's a point at which, well, you know what, there's really nothing that can be done, or is it never too late to begin?
I think it's never too late to begin. I can't remember the last time I saw a patient where I didn't have something to offer them or where it was too late. Unless you're talking about someone in the stage of terminal cancer, which I don't often see in my office. Most of the time people can help themselves and just tweak a few things in their life and really do well. We tend not to give, from a medical standpoint, we tend not to give hormones to a woman who hasn't had any hormones for 10 years after menopause. So that's probably the only restriction that I can think of that would limit me, let's say, helping a woman who comes in who's went through menopause at age 55 and now she's 65 and wants me to do something. The literature on that states to be very careful with that, and we tend to not start people on bioidentical hormones if they've been 10 years out from menopause. So that's the only case that I can think of. But there's other things that I would do for a woman like that. I would put her on magnesium and calcium and vitamin D to help her bone structure. I would have her working out 3 days a week. It's 45 minutes a time minimum to keep her bones strong and whatnot, and eating healthy and not smoking and whatnot. So the combination of good health, and it comes back to that for everybody really. Good health involves eating well and not smoking and drinking in moderation. In the world there's something called blue zones. I don't know if you've ever heard of that, but people like to hear this. Blue zones, there's about 8 of them in the world. I forget the gentleman who discovered this, but he termed it blue zones because he happened to have a blue magic marker looking at a map of the world, and he circled these areas in the world with the blue marker. So he called them blue zones. One is in Sardinia, one is in Costa Rica, one is in Loma Linda, California, and these are people who live to be over 100 years old. And the common denominator was most of these people lived long, healthy lives because of they were eating well, they drank little or no alcohol, they never smoked, they were surrounded by family and friends, which is important, they had some degree of spiritualness about it or religion, and they did a lot of activities during a 24-hour period, from farming to walking to whatever. So, you can really make things simple and find that besides our DNA, and DNA contributes to our lifespan too, but doing some just basic things can give you a long lifespan too.
Where can our listeners go and get more information about GenLife?
Come to my website at GenLife Regenerative Medicine, and I've got a lot of information there on age management medicine and biomarkers of aging and all the benefits of hormone replacement for men and for women. I talk about HCG, which you know about for dieting. People take HCG. I talk about human growth hormone, the benefits and risks of human growth hormone. And anything that can help people. I have weight loss we'll talk about in another segment, but all the things that can help people age gracefully and live a long life we talk about.
Great. Well, Charlie, it's been a pleasure having you back in studio today with us.
My pleasure. Thank you, Neal. Appreciate it.
You've been listening to Health Professional Radio. If you're just joining us, we've been in studio with Dr. Charles Mahl, certified in age management medicine by the Synergenics Education and Research Foundation. He's been in studio today with us discussing age management medicine and some strategies to help us all live better as we get older. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.